Only 16% of South Africans are able to afford private health care in the country at a cost of more than 142 billion rands a year. According to the Minister of Health, Dr. Aaron Motsoaledi, the cost of private care has increased by more than 300% over a 10-year period. In order to control the costs of healthcare to all, the government has proposed that a national healthcare insurance scheme be introduced, but the process has been 6 years in the making. Currently, the plan is being piloted at 11 hospitals. The public healthcare sector spends more or less the same amount as that in the private healthcare, but in this instance, it caters for more than 84% of the population, which means that private healthcare costs per patient are 5 times more than those in the public sector. To discuss the possible outcomes for such schemes under the National Health Insurance is the founding director and editor of Bhekisisa, the Mail and Guardian's Health Desk. Malan, good to catch up with you once again.
Thanks, Tim.
And great to know that you and your colleagues are doing such wonderful work and making sure that you put health issues at the forefront of our attention as members of the public. Now, by any measure, one would say it's grossly unfair that private healthcare should be 5 times more in investments and the benefits that accrue to the patient as compared to those that go to a public sector patient. And it compromises health care issues or the quality of care and a whole number of things, right? But let me go back to the National Health Insurance itself. It's been there, there's been a lot of talk. Where is it? When is it going to be introduced?
So it actually has been introduced. It's just being introduced in stages. So it was launched in April 2012.
Yeah.
First, there was a green paper, which is the sort of first document that the government, formal document the government released on it. That was in September 2011. And then that document said that the NHI will be introduced over a period of 14 years in this country. So that's been about 5 years now. And the agreement was that in the first 5 years, there wouldn't be any financial implications for South Africa. So you wouldn't have salary deductions or special payments for the NHI. So during that time, a few things have been done. The government has launched 11 pilot sites. It's 1 in each province and 2 in KwaZulu-Natal. And it's also put structures in place. For instance, the health minister established the Office for the Quality of Healthcare. So that is a body which goes to hospitals and gives them a score as to, and which sort of, where do they measure, to try and get a standardized way to get all hospitals, or a way to measure, to get all hospitals up to the same standard.
But here's the point of my question anyway. If it's there, how would I know that this is a pilot site? How different does it look to a typical hospital, and who gets to use those pilot sites?
So I don't think you would know it's a pilot site if you walk in there. You would know by the name. And generally, in each province, they've chosen districts. It's a district that's a pilot site, so it's not a hospital. It would be various health facilities in that district. And they've generally chosen the poorest health districts. So for instance, in the Eastern Cape, it is Oliver Tambo Health District, in the rural Eastern Cape and the former Transkei. And the idea of choosing such a poor health district is to see if they can make a visible difference in upgrading the infrastructure, in bringing more doctors. Whether that has happened, there's disagreement about that. Many people feel there hasn't been enough improvement and enough sort of visual differences that you can see to prove that the NHI can work. But of course, the health department feels a little differently. It feels that it has made some sort of difference.
Let's differentiate the public sector from the private sector, because almost even the service providers know themselves as private sector service providers, and there are public sector providers. But to an average person, a medical doctor is a medical doctor, a hospital is a hospital. And so it goes. The different specialists are the same in the eyes of the patients, irrespective of which sector. So what differentiates the private sector from the public sector? Is it the money spent, or what is it?
I think there are many things. I think if you ask the average South African, then I think there definitely is a difference in the sort of quality of service that you receive. And that is because the public sector is under-resourced and the private sector is very well-resourced, almost over-resourced. So obviously there would be a difference in the service you receive. So as you've said, it's the same doctors, they're trained by the same universities, but I think the difference is access. So people often would argue that if you, for instance, go to a tertiary hospital like Tygerberg Hospital or Chris Hani Baragwanath Hospital, that the expertise, the professors and the doctors that are there are often better than the ones that you'll find in the private sector because they've got academic research backgrounds, they're more up to date with what's going on, but it's the access. If you go to Chris Hani Baragwanath, you're probably going to wait 3 to 4 months to find access to that specialist. That's good, but you won't have access, immediate access. Where if you go to the private sector, yes, you may also wait for a while, but you're going to make an appointment and you're going to get it, and you're not probably going to wait for 3 or 4 months to see someone.
Probably within a day or two. Which leads me to this question then. The doctors or specialists or professionals who work in the private sector, are they the same as those who work in the public sector?
No, they're not the same. The private doctors generally do no service in public hospitals. There are private doctors who do services, particularly in more rural areas. They do often do that. But generally, if someone is a private specialist, they're private specialists. They don't share their skills with the public sector, which is obviously a very unequal situation.
And which, again, another question. I don't know of any private medical university in South Africa. They're all public universities, isn't it?
Yes.
And therefore, whoever gets trained as a professional is trained at the cost of the taxpayer or the public sector, isn't it?
Yes, at the cost of the taxpayer and also private funds, of course, right?
Yes,
That the student would pay him or herself.
Yes.
I have to point out that there have been requests for private universities, but they haven't been allowed.
Yeah.
Or not private universities as such, but what happens is you get training as a medical doctor at a university, and then you're required to do a practical internship of 2 years, and that can only happen in a public hospital. And there has been requests of private hospitals asking, come and do your internships with us. Of course, the health profile, the diseases that they deal with would be very, very different. In a public hospital, you're going to deal with a lot of HIV, with TB, and in a private hospital, you're going to have very different diseases that you deal with. So it's not going to be the same type of training.
Right. Now, let's go to the National Health Insurance itself. Its objective is to bring about equity.
Yes.
And I would think that from the point of view of the minister is to get some of the funding that goes into the private health care to come into the public sector, isn't it?
Yes.
So, how do they think it should work? I mean, is it an insurance scheme like a typical medical aid insurance that we all contribute to? And how would the contributions be differentiated?
Yes, it's if you wanted to compare it, it is like a one big fund of money, a pool of money that then gets used to serve all South Africans and pay for health services. Of course, whether that health fund is going to be administered properly is a question that many people have. So what's happening at the moment is 16% of the country has medical aids, and they pay a monthly fee to a medical aid. What would ideally happen is that fee that they pay to a medical aid would be paid to the NHI, so that all the money goes into the NHI. So a question that the middle class, the 16% of this country that affords medical aids have is, would you still be allowed to have a medical aid? So if the NHI is there and you don't like what they offer, would you still be able to have a private medical insurance fund? And no one knows at the moment. When the white paper was published last year, it said medical aids will be illegal. It will be banned. You will not be allowed to have one. And there was a lot of outrage about that. And then the health minister made an announcement and said that's not necessarily the case. But I think what is pretty obvious what would happen is that even if you allow to have a medical aid, it wouldn't look the same as now. And there are obvious reasons for that. Because if we get salary deductions, that has not been announced, but it's a very likely thing to happen, for you to pay a certain percentage of your salary towards the NHI. That contribution is likely to be sort of more or less the same as what you pay for a medical aid at the moment. It might be a little less, but it's not going to be 300 rands. You know, it would be a couple of thousand rands if you're a middle class person. And what would happen is that sort of lower middle class people of the 16% that afford medical aids at the moment wouldn't be able to afford both. So that would mean that the medical aid pool, the private sort of money pool, would become smaller because there would be fewer people who can contribute to it, and it's likely to become more expensive because there's a smaller pool.
But here, just a thought. Why are private medical insurance schemes not made to subsidize the public sector? I suppose that could be an idea, that it doesn't matter how much you pay, but 10, 15% of whatever is collected by private healthcare sector should go to the public sector.
They would, of course, argue that it's private funds, that it's not their funds, that it's, the medical aid members that contributes that money. And there could be, of course, an argument that a certain percentage of people who pay tax of their salary already goes towards the public to fund the public health sector. So it's not that people who pay for medical aids don't help to fund the public sector, but they certainly mostly don't use it. I think the question people have is, would the services be of such a standard that people who have access to private healthcare would be willing to use it? I think what we must think of is, if you want to answer that question, it depends where you come from. If you come from the public health sector and you're part of the 86% of the country or the 84%, then it will probably be better because there will be more resources if they're administered properly. You can't just assume because there's more money that it will be better services. It needs to be administered properly. But if you come from the private sector, no, it probably won't be the same.
But arguments can be made that there's a lot of overcharging that goes on, and there's no wonder we have this market inquiry by the Competition Commission that's taking place now. That there are a lot of things in the private sector that you pay for that you probably don't need, and some are exaggerated. But be that as it may, how soon is the national health insurance going to be introduced? Because to my mind, it's been long in the making.
Well, if you go according to the government's framework of 14 years and you count from April 2012, and it's 14 years then April 2026, you're likely, if it happens all according to plan, to have an NHI. And you might, have to pay for it and use it. And, no one really knows what will happen. Maybe it works like this. Maybe people who are used to private healthcare use some of the NHI services, but get a sort of a medical fund to top up services that the NHI doesn't provide, like a heart transplant or... so no one really knows exactly how will it work. Maybe you will take your kids to an NHI clinic to get vaccinated, but maybe you don't want to go to an NHI dentist. The ideal is, of course, that the NHI provides services that everyone is willing to use so that all South Africans, regardless of their income, can have access to the same quality and type of service.
Mia Malan, thank you very much for talking to us. Much appreciated. And she is the founding editor of Bhekisisa, the Mail and Guardian's health desk. Mia Malan, they've also got their own website, right? For people who want to find out more, what is the website called and the address?
www.bhekisisa.org.
And there you go. You can find out more about the NHI and many other health-related issues. And we are very keen to hear your thoughts on the introduction of national health insurance. Please write to us. The email is tonight@modise.tv.